We don't heal in beta mode. We heal in an alpha mode. This is our rest, digest, assimilate, and repair mode. Now, 7 to 12 hertz is that alpha range. This is why we use this frequency. It's kind of high theta and low alpha, and it gets you into that calm, relaxed state where you can actually begin the healing process. Hello, everyone, and welcome back to another Q&A episode of the Pain Free for Life podcast. I am your host, Dr. Rob Van Bergen, and I have a massive amount of questions today to get through. And I know I'm not going to be able to get through all of them, but I'm going to pick kind of the most popular ones or ones that I think are intriguing. I love doing these episodes. I think that it's really just there's questions out there that people ask that other people are thinking too. And so I think it's going to be a really interesting to cover some of these topics. So without further ado, and in interest of time, let's jump in. All right, so this first question I've got here, it's not on the first in the list, but it's one that actually really spoke to me. Is hi, I have a question about the correct frequencies for vagus nerve stimulation. Clinical studies on PubMed usually show that frequencies 20 to 30 hertz are best. Avazzia Life uses 7 to 12 hertz for vagus nerve stimulation. I'm a bit confused. Could you explain it to me? Absolutely, I can. All right. So 20 to 30 hertz, there's a reason that this is used. Most of the clinical studies you will see on PubMed for vagus nerve stimulation are for treatment of epilepsy. Now, when it comes to epilepsy, and it's really to prevent seizures, what you're trying to do here is you're actually trying to get the brain to focus. And so the frequencies 20 to 30 hertz sit in what we call a beta range. Now, the brain works on alpha, delta, beta, theta, and gamma waves. And beta is our fight or flight, normal functioning state. It's what's happening when we are alert. So when we're doing our job, in theory, unless it's really boring, we are in a we're in a fight or flight now, but a beta state. It is a high engagement state where our brain is focusing on things. And this is also where we are when we're in an inflammatory state. Okay, this is the challenging piece of this because a beta state is not something that with microcurrent we ever try to employ unless we're trying to get someone to actually focus when they're struggling to focus. And even then, we want to calm it down afterwards too. The reason for this is that beta is not a healing state. We don't heal in beta mode. We heal in an alpha mode. This is our rest, digest, assimilate, and repair mode. Now, 7 to 12 hertz is that alpha range. This is why we use this frequency. It's kind of high theta and low alpha, and it gets you into that calm, relaxed state where you can actually begin the healing process, which is just so crucial for anyone dealing with chronic pain, chronic inflammation, all of these things. So these studies are pretty contradictory for the treatment of chronic pain in most cases because they go against how the brain works, and the vagus nerve is connected directly to the brain. But for the treatment of epileptic seizures, it absolutely makes sense to use these higher frequencies because you're trying to get the brain to focus and be in that alert state where it is more protected from exterior traumas and things like that. So that is the reason that this is one of the questions that I wanted to pick. I think it's just so, it is something that people will stumble across if they're looking through. And I wanted to make sure I address that as well. All right, so now we have a weird one. It says, I have a weird question. I just found out that my husband's belly button never healed at birth. He has had a scab his entire life inside it. He picked it off as a curious child and it just bled and scabbed over again and stayed that way. How would I heal this? So as an interesting question, because usually these things do heal. First off, you're going to want to treat the belly button as scar tissue. Getting some sort of probe in there and working on the scar tissue frequencies of 77 hertz to start is the way to go. And then you're going to switch to the wound healing protocol. Now, this is going to differ depending on what device you have, but you need to get blood flow, you need to get inflammation down, you need to get blood flow in to bring in new oxygen and nutrients, and then you need to trigger regeneration. So if you have the Pinnacle device, you can use Sana IP, which is standing for injury protocol, but it is our wound healing mode. It has an all-in-one. If you're using our other devices, after you've done your 77 hertz scar clearing, what you're going to want to do is you're going to want to just use an anti-inflammatory, so something like 121 hertz, because you can't really paint over the belly button. You're going to need to get a probe kind of in there so that there's some sort of sensation on that. And after a few minutes of anti-inflammatory, you want to switch to something that brings in more blood flow. fMRSI is a great mode for that. And then switch on after that to a stimulation mode. Blue stimulation really just helps to trigger the healing process. So that's kind of the approach I would take. You could also do PEMF as well without G-Wave pad attachment, but what I would not recommend you do is do the scar tissue mode with that. You definitely want to work on the scarring with the microcurrent directly. Okay, so next one. Anyone know the difference between the Avazzia devices / treatments and frequency-specific microcurrent? So I get this question a lot, and honestly, they're very, very different beasts. First off, frequency-specific microcurrent says that a lot of the regeneration happens at higher frequencies, and a lot of the anti-inflammatory happens at lower frequencies. That's not what we see with our microcurrent. We see that lower frequencies do regeneration and higher do anti-inflammatory. So that's one of the first things, like the trainings and teachings don't even really align in that regard. Second is the way that these are formed in function. So our devices use computers to switch the frequencies automatically. So even when you're on a mode like 77 hertz, which sounds like it's just one mode, one frequency, it is actually changing and shifting constantly in response to your tissue. And it's actually working to change and initiate a conversation with the body. With frequency-specific microcurrent, you typically need to change the frequencies yourself, or you're using dual channel and you've got one frequency on one tool and one on the other. So you're actually having to alternate and change these frequencies more manually. The other thing that really makes these devices stand out is waveform. In many FSM devices, you're dealing with square waves. This is especially true of the cheap ones. Square waves are not necessarily body friendly, but they are easy to manufacture. They don't require a significant amount of coding. You're drawing straight lines, but they don't line up to the body's natural waves, which are sine waves. And our devices operate exclusively on sine waves. Why? We want to make sure that the body doesn't have a reason to fight back against the frequencies. We want it to think that the frequencies that we are inputting into it, the conversations we are having, are the same things that the body itself is thinking of. And it's like we're talking to it in its own language. We don't want it to be worried that something foreign is invading it. What we see with square waves is typically people will see the same results. They'll start to get the results at the beginning, but over time, those results taper off because of the fact that the body is starting to build a tolerance to resist those signals that simply don't make sense to it. Everything in our devices has been designed to push through the body and get the body to really understand how things work, even down to the voltage. The voltage of our devices allows us to push the current into the tissue without the need for gels or water, which you may see used in frequency-specific microcurrent. So all in all, although they both work on frequencies, they are very, very different beasts altogether in how they actually function. So the next question is, does anyone have a clue on how to treat vertigo with the evolution? I also have the scalar unit. So vertigo is actually one of those things that seems to respond best to tongue stimulation. So you should, if you've gotten one of the kits in the last couple of years, you should have come with a tongue stimulator tool, which is also known as the flexible Y tool. This will allow you to treat your tongue comfortably with microcurrent. And what this does is it actually sends the microcurrent impulses into the nerves in the tongue, through the nerves, and to the brain. So we use that as a bridge to the pons and then hit every cranial nerve. Now, this can be very beneficial to deal with vertigo because what it's ultimately doing is it's helping to reset the cranial nerves of your brain and calm them down, allowing them to actually function normally. So, typically, what you want to do is you want to use this treatment and activate whatever it is causing the vertigo. So, if it's consistent, you don't have to do anything. If it's walking, you kind of want to be doing the treatment while walking. If it's tilting your head forward, do something that would trigger it while you're doing the stimulation, because what this does is it allows your brain to notice what's going on and correct it in the moment in real time. Okay. So this is a follow up. Well, it's not follow up, but it kind of ties in this next question. If implementing the cranial nerve stimulation in practice for MS, so multiple sclerosis, Parkinson's, etc., or I guess in implementing this, is there a reference for us as to frequency of treatments and management of expectations and outcomes? Good question. That can always be challenging, right? Managing expectations. And I have had so many people that have had varying results from this in timelines. Some people will find one treatment makes a massive difference. Others will find that it takes several. So I think it's looking for the little improvements and tracking those as we go. These protocols, this is part of these protocols, but it is not the entirety of these protocols. Parkinson's, for example, often uses three pathways, and it uses the blanket. It uses these things too, which will help accelerate the outcome. Multiple sclerosis, the protocol might even not be fully updated yet on the video format. Is also now using 10 hertz, which has been shown to help regenerate the myelin sheath. Now, the myelin sheath in this is what is causing the breakdown. The breakdown of the myelin sheath is what is causing the biggest problem. So if we can start to rebuild and repair that, it can prevent these symptoms from manifesting in the first place. The cranial nerve stimulation piece, this is just a small piece, but it is a big one for sure in how it works to assist these conditions and assist recovery. I just think that the challenging thing is managing expectations. It is looking for small, subtle changes, tracking those, and knowing that that means you're making progress. Okay, so the next question is about scalar energy. So it says, does the scalar work for anxiety or bring an overall calmness to the body? So this is a multi-tier question. So let's start with this one. So yes, it does. And the mechanism of it is a little bit unknown. I think it's because it works to reduce the cellular chaos and therefore calms the body down naturally. Is having it, this is the next part of the question, is having it near you enough, or should it be on you to achieve this? So there's a couple of different theories of scalar, and there's this idea that we can place a scalar device in a room, turn it on, and walk away, and it will fill the room up. But I don't know how accurate that is with the power of the scalar as we have it. So I like to use it on the body, on the area. So for the scalar, for this, it would be pointing the scalar up at the brain. As far as the time frame, is there a time frame to use it, or can you use it as much and as long as you want throughout the day? Truly, there isn't really a limit to the exposure to scalar waves. I think you can honestly use scalar as often as you would like throughout the time period of the day, and you shouldn't have any real issues with it. With microcurrent, we don't want to overdo it. But with scalar, it seems very hard to overdo it. So I don't think it's necessarily a problem. Okay, so next question is a big one. And this is a question about infertility. It says, I've scoured the library on this page looking for protocols to help with infertility. I have a client with unexplained infertility, so no gynecological issues, but just an inability to get and maintain a pregnancy. She was looking on the internet and found that there are some microcurrent treatments for infertility and wants me to perform them. I currently see her for holistic nutrition counseling for the above problem. The protocol seems very vague to me in current medicine, and I only have an evolution device. Does anyone have any suggestions on what I can do and how often to help her possibly increase her odds of fertility? She's planning her third round of IVF in a few months. I'm positive vagal nerve stim will pop up in the suggestions. Yeah, so vagus nerve stimulation can help a lot with the stress of this because there's a massive amount of stress involved here. But you're actually looking at the gynecological protocol, which unfortunately is challenging to perform with the evolution. It is best performed with a pinnacle device because you get the scream. However, there is a version that we teach in the trainings where you can use the evolution and a stopwatch and time this. But this is going to be one of the best things. The other thing is there's often in these cases of infertility hidden scar tissue that isn't even being seen because they'll often do these tests and scans to try and find them, but it can easily be hidden in the uterine lining, and so it's not visible 99% of the time. So this is one of the things that we like to do here as well, is to paint over the uterus with 77 hertz. And to do this, not during this IVF cycle, but building up to it, right? As you're getting up to the point where you're a week or so away from beginning the medications that they usually will give to generate all of this, this is going to be the way to go. Do the scar tissue treatment. The other question is, I suppose, did she have success through IVF in actually getting embryos? So they've been able to get viable embryos, and it's just that she's not getting the implantation. So there's some follow-up questions to that too. Poor circulation can reduce growth of the uterine lining. And this can be something that we might want to be considering as well, is to improve circulation close to the IVF. But the important thing is that once implantation has started, once they've done the transfer, the embryo transfer, is to not do any microcurrent treatments. Okay, so hopefully that answers that question. All right, we're going to pick one more question from this list. I think we've been working through quite a few good ones today, some bulky ones for sure. Let's try this one. This one looks like a challenge people are having with the device. It says, question, guys, I got pretty much no sleep last night. I have a meeting earlier today, or I would have laid right back down as soon as I attempted to rise out of bed that morning. That said, I own an Avazzia Evolution as well as the smaller wave pad. I'm aware that there are protocols for getting you to sleep, and there are those for energy, etc. I feel as though I'm not breathing as deeply because of the short window I slept in. The fact that I was awakened several times and got awakened roughly 30 minutes before my alarm was due to go off. As wake time progresses, it's getting better, but I can feel that I should have slept longer. Add to this, I applied castor oil to aid me in releasing toxins, etc., but I didn't pair it with proper sleep to make it fully functional and beneficial. Needless to say, I awoke feeling very much the opposite of what I needed or wanted. What protocols are there that I can do to get me through the day? Okay, so obviously this isn't going to matter now because you've probably gone through that day already, but for the future, for anyone dealing with this, the first thing I like to recommend here for energy is going to be to do the mitochondrial recharge protocol. This could help add more cellular energy for sure. The other thing is to do, well, there's a quick protocol involving essentially waking you up. It's called a 10-minute energy boost or 5-minute energy boost. And essentially you're going to be dosing with 60 hertz. You're going to be dosing the different points, the 6 points on your face. So you've got your two points next to your lips, the 2 points under your eyes, and the 2 points above your eyebrows that are areas of the trigeminal nerve. And this is just the 6 points protocol, but you're kind of dosing these points, just dosing them to generate that energy and focus. Now, this isn't necessarily going to be the long-term solution, and obviously sleep is the most important, but that will help for sure. And then I would say, due to the breathing, some right side vagus nerve stimulation would help with that breathing balancing, because that works specifically on the lungs. Obviously, as I say, this is too late for the situation now because this question's been pulled and is being recorded probably weeks after. However, hopefully you find the information useful for the future, as does anyone else. All right, everyone. So I think that about wraps it up for today's episode. I have so many questions that get submitted here, and I'm trying to pick ones that are not answered in other materials or that are kind of unique, just to kind of keep it interesting and make sure I'm giving you the answers that you need. But we will keep the other questions in this compounded collection I'm getting. And obviously, we'll continue to add to that from any of your questions that you submit so that we can continue to produce these episodes. As I say, they're one of my favorite ones. I really like doing them. So again, thank you very much for joining me today. I guess we'll see you in the next one. I'm Dr. Rob Van Bergen, and you're listening to Pain Free for Life.